Good morning, Ms. Doe. My name is Ms. Ty, and I appreciate you taking the time to join me today for this virtual meeting. Today, we're just going to go over some things you and baby Doe can look forward to at his future upcoming physical assessments over the course of his first year here at our office. I would like you to know that the purpose of these assessments is to help monitor your baby's growth, development, and health to ensure that he's on the right track and to catch any concerns early. During the routine checkups, our team of healthcare providers will assess your baby's cardiovascular system, checking his heart rate, checking for murmurs and circulation. We will check his respiratory system, checking breathing patterns, lung sounds, and oxygen levels. We will check his neurological system, checking for reflexes, muscle tone, and his responsiveness. We also check the gastrointestinal system for things like bowel habits, feeding patterns, and abdominal assessment. The musculoskeletal system will be checked for movement, posture, and joint function. The baby's skin will be checked for rashes, jaundice, and/or birthmarks. And finally, we'll check the baby's sensory system, which will include visual and hearing checks, initial screenings, and behavior responses. I want you to remember that each baby has his or her own developmental milestones and that they develop at their own pace. But certain milestones are expected within time frames. For example, 0 to 3 months, we expect babies to lift head, follow objects, respond to sounds, and smile socially. Babies 4 to 6 months are expected to roll over, reach for items such as toys or keys, babble, and sit up with support. 7 to 9 month olds are expected to sit without support, crawl, respond to his or her name, and show anxiety to strangers or unfamiliar people. A 10 to 12 month old is expected to cruise or stand, say simple words, wave, clap, and things of that nature. Again, each child is different and their development is their own. These are just some of the expectations we look to see in their development. For babies' psychosocial development, that's from birth to 18 months. We center on a stage of mistrust and trust, or trust versus mistrust. Here it's like infants will learn whether or not they can trust their caregivers, will meet their basic needs as far as food and comfort and safety, affection. Consistent responsiveness and nutrient care fosters a sense of trust. Neglect, inconsistent care, or abuse can lead to mistrust, fear, or insecurity. The positive outcome for this is, if resolved successfully, a child develops a sense of trust and security, which becomes a foundation for future relationships and autonomy. Negative outcome is like a failure to establish trust and can result in mistrust, anxiety, and suspicion about the world and people. As far as nutritional needs, babies will need high energy for rapid growth. So like calories, high 100 to 120 calories a day. Macronutrients such as like carbohydrates, main energy sources like from lactose, fats, from calories, essential for brain development, DHA and RA. We need proteins needed for tissue growth and repair. Micronutrients such as iron prevents anemia, needed for brain development. Calcium and vitamin D for bone growth. Vitamin A and zinc supports vision, immunity, and growth. And iodine, essential for brain and thyroid function. Water, usually adequate in breast milk and formula. Extra water after 6 months if needed. We recommend 0 to 6 months exclusive breastfeeding or iron fortified formula. And around 6 to 12 months, we can begin complementary foods, but continuing the breast or formula feeding as well. So those are just some of the things that I wanted to talk to you about. And also, I just want you to know that as a parent, I would like to encourage you to interact with your little one daily, share any concerns you may have, even the small ones, because early intervention matters. Attend all well baby visits to ensure developmental tracking. These assessments are routine, non-invasive, and designed to support the baby's development without judgment and or labels. I appreciate you taking the time to meet me today to discuss what to expect here in our office. We are glad you chose us as your baby's healthcare providers. We are getting closer to delivery and wanted to reassure you that your little one will be in great hands. Do you have any questions pertaining to the information you received? Well, if there are any questions, feel free to reach out to myself or other team members. We are here to help with the new mommy transition. We too are excited to meet the little guy. Thank you.